We are back with a new episode. Sorry for the long delay. We're hoping to get back and get consistent. AT life and just life in general got in the way, trying to figure out schedules. For me personally, having a new physician's clinic schedule has been fantastic, but uh, took away a little bit of the freedom I had during the day around patient appointments. So finding time for podcasts has been interesting to say the least. That being said, we are on with another AT who has a physician scheduled. It's Dan Ruedeman, who is an AT that works in Ortho Trauma out in Colorado. This is a very interesting episode in a setting that, yes, ATs are definitely in the physician practice, but this one's just a little bit different. And Dan is very passionate about it and has some great insight. I personally learned a lot, which was great for my own trying to figure out this new setting for me and how to make the most of it. So, really good if you're interested in this setting to check that out. We are still going with the Throw a Lifeline giveaways that we're trying to do and raise money for. We are really close to getting our first one out the door. We're going to bring that one to the finish line here and get that out to some deserving athletic trainer that needs it to help provide the best quality of care. If it's something that you're interested in contributing to, please go to clinicallypressed.com/throw a lifeline. Any donation helps. $5, $10, whatever you feel like you can contribute. We really appreciate it. We'll keep coming up with ways from this end to put any money that we create and generate to that. So without further ado, please enjoy this episode. Well, welcome to this episode of Athletic Training Chat. We are on with Daniel Ruedeman, who, man, it seems like a really long time now, because it is. We connected on Twitter and then I've been meaning to get this going, but in my trying to figure out what my schedule is in a new role, have not done a great job of connecting, but we finally got together and we are going to be talking ATs and physician practice. As we were talking off air, this is really of interest to me. Not only because it's very interesting for the profession, but it's something I've moved into myself after being in the collegiate university setting for the last 10 years. So looking forward to picking up my own personal information out of this along with sharing with everybody else. But before I keep going on, I am going to turn it over to Daniel to fill us in on his background and how he ended up where he is today. And then we'll get more into ATs in the physician setting.
Awesome. Thank you, Joel. Hey, my name is Dan Ruedeman. I'm from Aurora, Colorado, and I work at the University of Colorado Hospital in the orthopedic trauma department there. I've been doing the physician practice setting pretty much solidly for the last 19, 20 years. I kind of did the non-traditional route. So I went to an unaccredited athletic training program in Nebraska and did the whole 1,800 hours in like a year and a half, student athletic training role, driving to events and stuff like that. And realistically only had 2 athletic training classes to my repertoire of all the things that I've been able to accomplish. And it's 2 classes. So just kind of got interested in it because I broke my ankle when I was 15 playing basketball, and just kind of the whole rehab aspect. And I think a lot of us have that similar story of an injury and the rehab and being able to give back. And the other kind of like non-traditional thing for me is being that I didn't really know a whole lot about athletic training, but I thought I did. I took the test way more than just one time. I took it 6 times. It took me to pass the test. And I always tell people about that story just because, everybody kind of, thinks, oh, I have to pass it first. Yeah, we want our cohorts to be as close to 100% as possible. Have that pass rate, but I'm here to prove to people that, I just didn't give up. My mentors didn't give up. I sought the help of a lot of people to try and figure this thing out and try and do it. And here I am, 20 years later, still practicing athletic training. So it's just a testament to the people that were supporting me and kind of driving me in my own personal drive to figure this thing out called athletic training. So um, been working kind of in that physician practice setting for off and on, like, around that 20-year mark. I have a little bit of experience in the high school setting, college, just in my undergrad. I don't have any other experience with that. Um, so it's always interesting for me to kind of share this side of things, because if you were here to tell me about kind of like the high school or the collegiate setting, I'd be just as interested, because I'm almost kind of clueless to how that setting goes and stuff like that. So I think it's actually pretty cool to kind of have these podcasts out there to kind of give insight, personal insight to kind of people's journeys. I think we all have a lot of similarities, but we all have quite a few differences as to where we are in our journey, and what got us to athletic training. But yeah, I've been at the University of Colorado Hospital for 7 years and work with orthopedic trauma. And, I have experience and I've scrubbed in on surgeries with sports medicine physicians, but trauma's a lot different, and it's not meant for everybody. I think it takes a special person. I'm pretty blessed to be kind of that special person that trauma and I just kind of mesh. And I love my patient demographic. I love my patient population. A lot of people that just need a lot of help. And it's one of those things where I just love to be able to support them and coordinate their care as much as possible. So here I am, being able to share with you and share with everybody else kind of what this setting means to me, and kind of how I got here. So I appreciate it.
Yeah, and I think that can kind of lead us into, a little bit more of your background in the physician setting. So I'm in a sports medicine clinic department within, and then also working as we're kind of hoping to build it out, work with our orthopedic surgeon who's also a sports med physician. And ultimately, I think not currently it's in the cards to necessarily get into the OR and do all those type of things, but that could be a thing down the line. Just how has that evolved in your own career, kind of working from that, and then to really get in, to orthopedic trauma as an athletic trainer? I don't know that many. I know for me, like you're the first one that I've met. I'm fairly certain that have gone and done that. So how do
Yeah,
how do they kind of end up in that one specifically, and that'll tie into a lot of the other questions we have.
yeah, absolutely. Because I think as a lot of people can connect with, like in athletic training, it's such a small world that it really kind of depends on who you know, and the timing and everything, and kind of how things happen to you. So um, I was fortunate to meet some awesome mentors, and one of my biggest mentors was Tate Erickson. He ran the athletic training fellowship program, which is now they're called residencies, but the athletic training fellowship program at the Stebbins-Hawkins Clinic in Vail, Colorado. And
Mhm.
I remember I had actually applied right after undergrad, and I hadn't even taken the test yet. I mean, I was a long ways away from being where I am at now, and I applied. I still have the letter of, basically saying, sorry, we didn't select you for the Stebbins-Hawkins fellowship, but ended up reapplying several years later. Tate kind of ran that program. He was a fellow, and then he ran the program, and then we connected in New Hampshire and built a pretty good program there at the Dartmouth Hitchcock Center in Keene, New Hampshire. And then he kind of just molded me a little bit towards that kind of physician practice mold that the fellowship really kind of does. And so with his help, got an interview and completed a 1 year fellowship in Vail, and then worked with another physician fellow in sports medicine. And I always wanted to be able to scrub into cases and stuff like that. And there's so many variables that kind of come into play with whether or not you can scrub in. It's you have the credentials like the OTC. I know the NATA is coming out with some orthopedic specialty certifications um, with regards to kind of furthering the education of specialty in orthopedics. So I was OTC certified, started to scrub in some cases, helped with ACLs, rotator cuff, meniscus repairs, meniscectomies, things like that. But it really kind of depends on how the physician and the facility kind of work together, and do they acknowledge that certification, and what does that mean? And not everybody acknowledges OTC, or surgical assist, stuff like that. So there's a lot of different routes that I think athletic trainers can go to be able to get themselves into the OR. But I encourage a lot of students, to be able to do these clinical immersions, which are a requirement for their programs through Katie. I take anywhere from 7 to 9 students a year to come out and shadow me in the orthopedic trauma rotation, and they're there for anywhere from 6 to 12 weeks. I think just to get a taste of that stuff, and we can go into that a little bit later too, like, kind of what my program's kind of about when I do these immersion programs. But I think it's important for the students to really kind of see the surgical side of things if that's interesting to them.
Mhm.
Each one of these residencies that are out there have kind of this subspecialty, like what are they known for? And I think it's important, if they're interested in going into this setting, to look into that setting. Do you have to have a residency underneath your belt to kind of be successful in that setting? I say absolutely not. I think it comes to your training, kind of who you're working with, and kind of the trajectory that you want to go on. I'm just fortunate that I was able to do a residency, and to be where I'm at right now. But I think there's just a lot of steps along the way that, if you choose to do those, you'll be really successful. But I don't think you necessarily have to do all of the steps to be successful. Obviously, my step process, my journey wasn't the norm or what I would suggest other people do, but it worked for me. But I think it's important to know that it's out there. This physician practice setting is out there. It's fun. It's enjoyable. It's super rewarding. But it can play with a lot of different um, things for these athletic trainers. Like, what do I want to get out of this career? What do I want to be able to provide? And it's not for everybody. Not everybody likes those settings. But I think for me, like, being able to scrub into surgeries and see what a meniscus feels like, and see the rotator cuff, and see how ACL reconstructions are done, is pretty cool. Because I think once you understand the surgical side of things, you see the injury, see the surgery, see the rehab and the prognosis. It just gives you a better education, a better mindset to be able to plan ahead and kind of see that. And that's one of the things I push with with these immersion programs, is look at an x-ray, understand what caused the injury, what
Yeah.
the injury is, and then how are we going to treat it, and what's the prognosis like. So they kind of get that whole gamut of things to be able to look at. When they see that x-ray, they automatically in their mind know, oh, I know how we're going to treat this and what we're going to do for it. So it's just a different approach. Not saying it's a better setting than anybody else. I kind of sell it that way because that's my job, is to sell, physician practice setting. But everybody in their own setting is going to do that, and that's what I think makes athletic training pretty strong. Is we all want to sell what we do.
For sure. No, to your point about how much you learn, I had run a collegiate department for 7 years, and then came out to the clinic and felt like a complete rookie again. But the amount of
Yeah,
x-rays you see in a given day, and MRIs, and we do a lot of ultrasound guided things in the physician practice we have. So just seeing that over and over again, my base knowledge has just grown substantially. I mean, they're talking,
yeah,
joints that you probably heard about or learned, like in the
yeah.
wrist and different things, or that, but you just never really encountered it in a otherwise healthy, young population compared to the big ones. But man, do you learn quick that you get humbled that you didn't know as much as you thought you did.
That's one of I'm glad you brought that up, because that's one of the things that I really kind of push with the students. And I'll again, my route is non-traditional, and
Mm-hmm.
to the extreme. But that's one of the things that I tell people all the time. I didn't think I was needing to get humbled, but I'm very glad that I did. Probably within 3 days or even 3 minutes of being in the fellowship at Stephen Hawkins, I got humbled real quick. And
Oh, I can only
it's
imagine.
it's it's a good experience. Tough at the time, personal at the time, but at one of those things, that's what I ask students when they come here, is like, what has been the most humbling experience you coming into this setting? Because a lot of us as athletic trainers, we think we know how to fit a brace, we know how to do this, we know how to do that, but can you actually explain it and have a conversation with a patient regarding it? What words can you use? And so I really stress repetition and routine, because if I can walk into a room and I know it's a, you know say it's a bimal ankle fracture with a syndesmotic injury, like I know what my talk's going to be about.
Yep.
I know how the conversation's kind of going to flow like, and it just makes it easier for me. And it just takes time. And a lot of times as us as athletic trainers, we don't always have time, even though we spend a lot of time on the job. We don't always have a lot of time. We want that now. We want to be able to be that, have that comfort level now. But it's fun to watch these students kind of transition to um, a lot more confident practitioners, student practitioners, and stuff like that that gear them towards that. And I just want students to come here, have a great time, learn a lot, but also to go back and tell their program and other students like, wow, this is a pretty cool experience. I learned a lot, and then take that to the high school, the traditional settings, to the industrial, military, whatever. Take
Mhm.
that knowledge and go and play with it. And that's what I want to do, is just give them that a little expansive little bit to move forward for that.
Yeah, I liked what you said about communication. That's one thing I've had to get better at. We do some
Right.
amount of same day kind of rehab exercises to get people started. You got to,
Yeah.
it used to be however long of a conversation that you wanted it to be, or the fact that you knew you were going to see that athlete again the next day, and condense that down into 15 minutes where you're not only trying to explain it to them, give them the proper cues, but also get them to buy in that this might actually help them when they walk out the door, and you might not ever see them again, or you'll see them in a couple, 4 to 6 weeks if it
Yeah.
fails. And so yeah, that's been a unique challenge with trying to find those things that seem to connect with different people.
Yeah, and that's what I tell a lot of the students. I was like, I want you to be able to learn to read people. And
Yeah.
what I teach with these immersion experiences are what we call soft skills. It's the
Yes.
communication, it's the listening, it's the mirroring, it's the reading back. Because I think that's a lot of us, we hear, but we don't really listen.
Sure.
Can we take into consideration what the patient's going through, put ourselves in their shoes? And I think, a lot of programs around the country, you know, can we get better at working with our students about empathy? I don't know if you can teach it. I think it's an inner piece of who you are.
I think
But
emotional intelligence could be something that can be
yeah,
kind of taught to try and hopefully discover it. But yes, I hear you.
yeah. Yeah, and I think for me, I have, traumas. One of the kind of running things with one of my MAs that I work with, and in this setting, I work with medical assistants, I work with nurses, I work with nurse practitioners, PAs, and I think they're called APPs now, and providers. And so, as athletic trainers, we are, I think, one of the foundational things that we have about us is we're team players. We've got to work with an assortment of people to be able to collaborate to come up with a game plan. And I think as an athletic trainer, it's a humbling experience that if we utilize what the resources are around us to be able to plan accordingly for our student athletes or our patients, it just makes the experience so much better. So I just really push experience with our students and for our patients. I don't want them to just say, I'm coming in to see the doctor. I'm coming in to see orthopedic trauma. Orthopedic trauma can be, for my medical assistant, he was like, it's an injury. Yeah, it is, but there's a lot more to that. I deal with gunshot wounds, failed suicide attempts, um, patients just stepping off of a curve. I deal with fragility fractures. I deal with a lot of um, social and economic status issues, patients that are undocumented, patients that are, don't have insurance at all. How do I go about that? I have resources. I have an assortment of opportunities for these patients to be taken care of, and it doesn't necessarily have to go through us. So care coordination is a huge thing with bringing a patient in, is how can I make their experience so much better? And if they need an MRI, CT, try and get it done while they're there. Just creates a better opportunity. And I have a direct link to the emergency room where a majority of my patients come in. My nurse practitioners or PAs do the ortho consults during the day, and so they'll text me or call me and say, hey, get this patient in. So before the patient really is even seen by orthopedics, or even before they leave the OR or the ER, they got an appointment to come and see us. So it
Okay.
just creates a better experience for the patient. And what can we do to take care of them better than when they came in? I think that's a huge thing for us to take on, is what works for our providers, what works for the system that we're in.
So we talked a lot about on a kind of a macro level what you do, what does a normal week look like for you? I mean, you talked about scrubbing into surgeries and being in there, but just and working with everybody. If you could just kind of outline that, for somebody that might
Yeah.
be curious, is you know how often is any job kind of a 9 to 5, but just general hours or what that week looks like.
I think it's important to know because again, I'm pretty blessed with the position and the people that I work with. I work 4 10s, and I think across the
Okay.
board, there's not too many athletic trainers that can say that I work 4 10s. Like as of right now, I don't work on Tuesdays, and then in September I'm going to switch that day to Fridays. But with orthopedic trauma, there's clinics 5 days a week, and it's about working with my staff. It's not my staff, I just say my staff, but it's working with the medical assistants. And I do have another athletic trainer that again didn't go through a residency program or anything like that. Is just was curious and interested to work in the physician practice setting, and applied for a job, and I think she'd be a good candidate, and she's rocking and rolling right now. So excuse me, I think it's important to really work with your staff, that no matter who's in clinic, they're going to run the clinic the right way. And it's based off of what the providers want, not what I want, not what the MAs want. How can we make the experience better for the patient? So Monday I typically work 7 to 5. If there's certain days I don't have to like pick up my kids early or something like that, I'll stay late and get some things done. But realistically, most of the clinics start at 7 a.m. and then wrap up around between 2 and 3. So there's a lot of phone calls and triages that you kind of have to balance in between there. But normal day is me rooming patients, ordering X-rays, MRIs, CTs, bringing those up, actually talking to the patients a little bit about them, plates and screws, kind of going over the hardware that's inside, um, having a lot of just discussions with the patients. And I haven't done a physical exam in a long time. Can I still do a Lockman or a drawer? Absolutely. But on a patient, I haven't done those for years. But I feel like if you really truly ask the right questions and you listen to your patients, they'll tell you everything that you want to know without even having to
Absolutely.
touch them, and just being observant of the whole environment, how they're doing, their body language, things like that. I think it's important to be able to have, again, those soft skills. I don't teach athletic trainers how to do, physical exams when they come in and do an immersion with this. That my whole approach is a lot different than that. I think they're getting that knowledge in the classroom. I'm going to teach stuff that's just not taught in the classroom. Tuesday's normal day off, but again, I think it's important to push that to the athletic trainers that are watching this, and for everybody that's going to listen to it, is what value do you put on a day off? What value do you put on something like this that allows you to take care of the stuff for you? And so to me, it took a long time for me to learn work-life balance. And I think again, that's not something that's taught in the classroom. Um, it's something that I think something has to change in your life for you to realize that.
Sure.
So what is it going to take for you to take care of yourself so you can be the clinician and the provider that you want to be? Wednesday morning is my only admin day, so I get a half day of admin. So in the morning, it's just taking care of things, paperwork, FMLA, short-term disability forms, work notes, whatnot that needs to be done. And then I have clinic in the afternoon, and then clinic all day Thursday, and then clinic all day Fridays. And then weekends are off. So no coverages, no outreaches. It's just primarily, clinic based. And so how can I be successful? How can I measure um, data, money, all those things to the organization? What is it that they need from me to be able to say, hey, I'm a serious part of this patient care aspect that we provide here in trauma. So as an athletic trainer, how can you sell yourself? How can you provide the data that organizations are looking for? What is it that provides value? So that every day is a selling point for me. Like, how can I prove my worth, show my worth? And in the hospital setting, it's more indirect revenue than direct revenue. And I think it's important for, again, athletic trainers to understand the difference of those two. So there's just a lot of variables at play when it comes to this setting. But I'm again pretty blessed that I work 4 10s, and it's pretty awesome.
Yeah, we've had that discussion here. We don't do 4 10s, but we're basically we're 5 days and in at 7:30. I mean, and if we're walking out at 4:30, it's late for us because our clinic runs 8 to 4 with our physicians currently. So that's been
Yeah.
a big change, and that's one for me personally. I went through, I took a small pay cut to come from the position I had to here, but my hourly rate shot through the roof because I got so many hours of my life back.
Yeah,
That,
absolutely.
that if you look
You're
at,
you're home.
I'm more valuable to myself now just because of that time. So,
Yeah, absolutely. And I think again, that's really what I push with the students is to take into consideration. You can see how I do things here at the clinic. Take what you want from this venue and this experience and push it towards what you want to do. But I think at the same time, it's giving them an opportunity to kind of figure out what it is that I'm looking for and what value can you put off on being home at 5 o'clock. And if you have a family, kids, like being able to pick them up from school and all those things, and it's like I'm not working those late long hours. And that's a tough sell for a lot of people and justifications and all that. So I think that's a whole nother topic, but I think that's a good thing for me is like, the days off, I'm getting my pilot's license. So on my
nice.
days off or on the weekends, I'm flying airplanes and I'm doing things that I've always wanted to do now. My kids are slightly getting a little bit older. They're 9 and 7. So it's like, they're off at school. When they're off at school, I'm going to go take care of myself. So
Perfect. We kind of talked about just kind of briefly, unique certifications or trainings, for the different duties you had. You mentioned OTC and then yes, the BOC with their kind of specialized one that they're putting out. I know
yeah,
a colleague I've had actually went back to school to become a surgical tech, decided that that wasn't really for them, and now is back into the AT realm. But if somebody were kind of looking to, you know, beef up their resume if they didn't go through a residency, or that it's a highly competitive, so they just want to maybe enhance their skills, are there other ones out there that you've seen or you've done or you'd recommend, or even just general workshops or knowledge that you've gone through that would be beneficial?
yeah. I think I think it takes it takes a little bit of time for serious thought of like what the athletic trainer wants to be able to do with their career. Where do they see their projection going?
Mhm.
Um, for me, yeah, I had the OTC, but I let it lapse because I don't feel like it was necessarily benefiting me, working for me. I wasn't utilizing it. A lot of times there may be some misinterpretation of what its value is. And
Sure.
what its value is basically dependent on the facility and the organization in which you're trying to utilize it, whether or not they recognize it. And a lot of times when people have the OTC, they think they're casting and splinting specialists. And to me, in my opinion, it's more surgical based. You have surgical skills. Yes, you have the casting and splinting stuff, but realistically, that OTC is a little bit more towards the certification for surgery, and then they have the surgery certification of that after a year of work with it. Then you can start to suture and close alone when you have the surgical certification. I think we'll see how these BOC orthopedic specialty credentials kind of work and benefit. It's just whether or not organizations will recognize it. I think we just have to give it some time to kind of see how it's going to flourish. I have a lot of friends and colleagues that kind of worked on that. So it's been a lot of long days and hours working on questions for the exam and the development of it. So I think there's been a lot of progress with that. There's an orthopedic PA program out there, certification. Again, just whether or not the organization is going to recognize it and what are you going to utilize it for. And I think it's important to kind of look into that, and kind of see, because like with the OTC, what was a little concerning for me was just you had to pay for each CEU as you submitted them. And so on top of going to all this, these conferences and getting the CEUs, now you're having to pay $2 per CEU to submit that. And sometimes those costs can just elevate, and kind of, push people to be like, oh, I don't want to do this anymore. I just wasn't using the OTC. So I let it lapse because I've worked at the hospital setting for 7 years with trauma, and I have yet to even be in an OR. I haven't even watched one of the surgeries yet. I've just been so busy, and it's a teaching hospital, so there's quite a few people in the OR already, and the more numbers, the higher the infection rate. So to me, I'd rather have my patients have a better outcome with less infection rates than me watching a surgery. I'll take care of them on this side of things. But I think again, it's in seriousness. I think it just really depends on kind of the approach that the athletic trainer has, where they see themselves, and do they feel like that certification or credential will benefit them. But I wouldn't just get the credential to have it, because you may not be able to utilize it with the institution that you're with. But down the road, maybe. So I think it's something that we continue to kind of discuss and work with, and kind of see how athletic trainers can evolve around those or with those. Because right now you look at my credentials, I have my college, my MS, and then I have my ATC and my LAT, and I work, being in Colorado, we've kind of had some fluctuations with the licensing and stuff like that. So I think it's important to focus on that too, but at the same time, like, I don't have any of those those specialty certifications, and I'm doing okay.
Absolutely. I think that's a good point to make, is that yes, they can be complementary, but not always required.
Yeah.
Where do you see the future of this setting specifically going for the profession? Obviously, we referenced the BOC certification and how that may have an impact, and then just really the impact of this setting on the profession. Loosely following it on some AT social media, it seems like there's a shortage of ATs to fill jobs, and I was just clicking through a bunch of them on the Career Center the other day, and I can understand as to why, with a lot of them that are posted, why they may not be getting filled. But how do you see this ATs in this setting and where that's going to go?
I mean, we're in a good spot right now, athletic trainers in the physician practice setting, because there's opportunity for us to kind of keep pushing this. And I think that's, again, while I'm pushing it to have students come out and shadow, I think I'm just trying to gain some exposure for other athletic training programs to kind of have their clinical educators kind of allow students to venture out, and to kind of see what other opportunities there are, rather than just around where their school's at. But I think if we continue to offer these residency programs, there's a lot more now than when I did them. And I think just having that educational experience that's just a little extra out there for them, I think would be beneficial. But again, everybody's entitled to have those opportunities. So whether you're in the high school, collegiate, performing arts, whatever, you can still do a residency. And I think those are super beneficial, because the value of which you are able to take from those programs. But I think there's the Society Athletic Trainers, and the Physician Practice Society is out there. It's been functioning for the last 4 or 5 years. I'm the sponsorship chair as of right now, working with a lot of the educational teams, the finance team, the IT team. It's working again as a team player within the society to get the athletic trainers what they're looking for, content wise, job market wise. So we're really focused on providing education, mentorships, preceptorships, with regards to athletic trainers that are interested in this physician practice society. And so we continue to push for the content with that, and it's just solely focused on that. And I think we just keep pushing with the NATA, and keep working with a lot of organizations to kind of promote athletic training in this setting. I think it's just going to continue to get better and better. And I think you're going to see a lot more athletic trainers, looking at this setting, because of how rewarding it is, because of what you can get out of it. And again, not taking anything from the high school, the collegiate settings, they have their own basically benefit programs that they use. But I think it's important to know that, yeah, there are a ton of athletic trainers that are interested in this setting. And it's like, we just have to keep working with them and keep creating opportunities for them to learn and to be able to grow, and go to these conferences and really kind of educate doctors as well that, this may be a benefit for your practice. And again, it's slowly getting out there. And I think we're gaining some ground pretty good. So.
Yeah, I'd agree. I think it could be a unique opportunity, and I don't know if this is a nationwide thing, but from what I've heard, even locally, the struggle to get nurses there just seems to be a shortage of them to fill spots too. So especially in some of these orthopedic sports med clinics where an athletic trainer is so versatile and
Yeah.
so many things that it is a game changer for a lot of places and just makes the efficiency run so much higher.
Yeah, and that's one of the things that I really have the students look at is just watch and learn and listen to how these clinics are ran, and whether they have any experience, walking into a clinic and rooming patients or anything. But what little things can mean so much across the board, across the day, across the year for these providers. Just to have opportunities to treat more patients.
Mhm.
That's what we're trying to do. We're trying to create exposure to be able to have a more efficient, more effective practice in orthopedics or non-surgical sports medicine, all across that board. So I mean, there's athletic trainers actually working in oncology, so it doesn't have to be just orthopedics. That athletic trainers have that skill set to be able to kind of be cross genres or subspecialties to be able to provide that same level of care. And to me, we just can be a great collaborator and work with multiple disciplines across all kinds of different settings. And I think that's what we need to continue to promote, is just the flexibility, but also the understanding that we don't have to work 80 hours to show our worth. We can work at, show our worth in 40 or less.
Agreed. Totally agree on that one. Kind of the last question I had is, you talked about the promotion of this setting, and trying to get the exposure not only to athletic trainers but to physicians. Um, what have you learned specifically in trying to promote this setting that I'm sure applies across kind of the broader scope of the profession? I'd just be curious because you have spent a lot of time kind of promoting this specific setting, if there's things that you've taken away that you found to be most useful.
I think, so I go across the country and try to connect with athletic training programs across the country, again, just to promote this setting. And I've kind of been doing that kind of on my own. I'm not getting, compensated by anybody to kind of go out and do this. It was just kind of one of those things because there were so many people that helped me. And I think that's one of the driving forces is to give back. And the athletic trainers that helped me be who I am today in my profession, this is my kind of nod to them that says, hey, thanks for going out of your way and spending many hours to help me be successful in this program. Is for me to go across the country and say, hey, here's what I'm doing in orthopedic trauma. Does it interest you? Is it something that you'd be willing to come out and hang out with and kind of watch and learn and kind of do that? So just creating opportunities. Our clinical immersion sites on the NATA website. We have our own website with the University of Colorado Hospital. We have our own residency program for athletic training as well. So kind of just promoting kind of that whole advanced education per se of kind of experiences. But to me, I just want to be able to create an opportunity for athletic trainers to be able to say, hey, I have a venue to be able to say, hey, I can make a difference. And so when I have students come in, I only have one requirement for them. What they come and get out of it is up to them. Their commitment is up to them. But I said, your only requirement is at some point in your life that you give back to something or somebody, and to try and just keep that moving and keep that going forward, because this is my way again of giving back to the people that helped me kind of overcome the fact that I couldn't pass the test, didn't have the knowledge to pass the test, but me acknowledging that I needed the help to be able to do that. So I really kind of pushed that. But I love talking to students about just a different aspect of athletic training and different aspect of level of care. So when I do my talks, I really kind of get into it. And I was like, we can have an opportunity to impact patients' lives. So for the last 4 years, when I kind of decided to have this, work-life balance shift in my career, I was like, here's my goal. I want to leave an impact. I want to impact somebody's day every single day while I'm at work. And for the last 4 years, I feel like I've hit that. I've knocked it out of the park, but it's given me a different side to kind of push towards, a different vision. Like, I just want to be able to help people out, whether I'm on the phone with them, face to face, through an email. I want to be able to say, like, I helped them out. I did what I was supposed to do while I was here. And to be able to leave that lasting impression. But again, giving them a good experience rather than just, oh, I called and talked to my doctor today. Like, I want them to be like, hey, I called and talked to Dan today. He was really great with this. My team was great with this. My providers are great. But one of the things that I do is I do these empathy talks with my patients, and it's kind of got the name Dan Talk now at the place that I work. Um, but it's about going in and listening to the patient. What are they needing in order to be successful? What do they need to be able to get through this hard time that they need? Do they need social work? Do they need benefits, a place to stay? There's homeless shelters all across this area that I work. Can I get them a bed? So it's working with a bunch of different subspecialties, social work, other aspects in the hospital, giving them food vouchers for people that haven't eaten for a while. It's like, what are you willing to do to go out of your way to make somebody's day a little bit better, a little bit easier,
Sure.
to be able to help them through that? So I'll go in and I'll talk to these patients for a good chunk of time. And, it's easy for me to do this. Yes, it takes time, but it's taken the time away from the physician to go and see other patients. And then this patient has a good experience. Everybody gets my card. Everybody gets my phone number to my desk, so they have a live person that they can talk to. And I take pride in that, and I take pride in the fact that I can leave a lasting impression on somebody, hopefully a good one, to be able to give them the confidence that we know what we're doing. And I always tell people I just feel like I run a different orthopedic practice. And again, not that it's better than anybody else, but this is just what is successful for us.
Sure.
And I've been with the same doctors for 7 years now, and we just have a really, really good relationship. It's fun, it's professional. We do stuff outside of clinic together, so we really know each other. And I think that's important too, is establishing rapport and relationship with who you're working with, and taking care of them.
Sounds awesome. Sounds like a great place to work.
Yep, absolutely.
Anything else you wanted to cover around your work in this practice that we haven't gotten to? And if not, we can jump into the AT chat questions.
Let's get those questions. I'm good for that. I feel like, if anybody wants to reach out and talk about clinical immersions or any other stuff like that, I'm sure you'll have my contact information on there. If not, I can definitely give it to you. So
Yes, we'll ask for that in just a minute so we can make sure we list
perfect.
them all. So, all right, first question. And we've kind of talked about this, but we'll see on more of a macro scale, is where do you see the profession of athletic training going in the next 5 to 10 years?
As a whole, hopefully continuing to expand. And, I think we're still pushing that safe schools aspect. I think we're pushing for high schools to have athletic trainers. I mean, we're in two-a-day stuff now. If they're still doing two-a-days, I haven't been in a high school setting for so long. I don't know if they're even doing
I hope
two-a-days.
not.
But at the same time, like, preventing death in the high school, transition of summer, not doing a whole lot to now we're playing football and these two-a-days things. We're still struggling with how do we manage that. So I think the more athletic trainers that we can have in the high schools is setting a good foundation for that. Keep pushing the athletic training, different settings, the military, the high schools, the colleges, the physician practice setting, performing arts, the industrial settings. Like, there's just continuing to be opportunity for us. How do we get into those settings? So like non-op sports medicine clinics, primary care sports medicine clinics can still benefit from having an athletic trainer on site. Again, it's just providing a different level. Not that we're going to be taking anybody's jobs, but just providing a different level of care, expertise, and how we can work together with other subspecialties. So I think it's just an important aspect to continue to look at and say, okay, how can I make a difference? Am I doing what I'm supposed to be doing and how I'm supposed to be doing it? I hope so. But I just want to continue to promote it, continue to sell this. And also, athletic trainers, there's athletic trainers out there wanting to use this as a stepping stone to other careers. Great. Keep advancing your career for what you want out of it. I think that's important too, is, use this as a stepping stone. I'm fine with that. Am I successful in athletic training? I think so. And I'm going to stay in this setting. But others use it to kind of get them where they want to go. And I think that's absolutely totally fine with that. So I think we're going to continue to get bigger and bolder. We have a new president now, maybe a different direction, who knows? But I think, a new set of fresh eyes and ears on everything. This is just going to continue to get bigger and better, I think.
For sure. What advice would you give to yourself as a younger athletic trainer if you could go back, and if you can, set when that would be in your younger self?
I've actually, when you sent that list over to me, I thought about that, and like, would I go back and tell myself, study, go to an accredited school, like actually pass the test on the first time? No, I wouldn't do that. I would actually stay that same course. Like, I've learned so much from not passing it for 5 times that has kept me motivated to continue to push other athletic trainers. Whereas maybe if I would have passed it the first time, I wouldn't be as motivated. I don't know. So what I tell myself is just to stay strong, stay motivated, reach out, continue to ask for help, continue to develop my network of people that I can rely on for support. But I think the biggest thing for me is the work-life balance. Like, how can I take care of myself so I can take care of others? I can't take care of myself and take care of my kids if I don't take care of myself. So I think that would be the biggest thing that I would continue to push myself. And that's what I push with a lot of the students that they're in their early 20s is, how can you take care of yourself? That's not something that we kind of push at that age. We're more geared towards a lot of other things. But when I was in my 20s, I didn't know how to, that wasn't my thing. Like, yeah, you kind of have that lifestyle. You're out of college. Like, what do I do? Like, I think right now it'd be, all right, how do I manage work-life balance and be good at it so it doesn't affect me when I'm in my 30s and 40s?
Sure. What has been the most influential resource you've found in your career?
Oh, that's a good one. Definitely the friendships and the networks that I have collaborated with over the years. There's, my two really good close friends, Tate and Thad. I talk to those guys. We text every single day, and they're athletic trainers, and they're athletic trainers in a different realm.
Mm-hmm.
One's in administration, one's in prosthetics and bracing, and I think it's important, again, they don't all have to be in the same setting for us to be able to collaborate and talk about things. Like, we don't hardly talk about athletic training. We talk about life. We talk about, how are we taking care of our kids? How are we taking care of ourselves? Like, what is it that motivates us every single day? And I think having that tight knit group of friends that you can rely on, it's important as we get older that they're there for us. And I think I would, that's probably another thing I would kind of push my 20-year self, is to establish that good core group of friends that I feel like would be there for the long haul. And so I think having those established networks and connections has been ideal, and definitely mentorship. And then for me to be able to say, I want to do the same thing and teach these students how to have somebody there to help guide them if they need it, and be a mentor and a preceptor.
That seems to be a common answer that we've come across on the show. So it's
Yeah.
always good to get it reinforced.
Yeah.
If you could change or eliminate one thing, could be a modality, a common practice, a mindset, or whatever of your choosing in the field of athletic training, what would it be?
I think what I've kind of learned along with some other athletic trainers is just, if we're thinking about rehab in itself, which is a very broad topic, I don't want to focus on just the ankle. If they broke their ankle, I don't want to just focus on their ankle. I want to focus on the whole body. Is the whole body functioning really, really well? And I had a good friend, good mentor that really taught me that and kind of showed me the benefits of that. And he went to the Gary Gray Institute of Functional Assessment, and just kind of being able to really kind of assess the whole body. And I always push core and glute exercises, and that really wasn't taught to me in a lot of my rehab education, that it was essentially self-taught. it was just like focusing on that one spot that was hurt. Let's focus on the whole body, make sure the shoulders and balance and the back and core are all good. The ankle will take some more time to heal, but let's get all the other stuff functioning a little bit better and see if we can get that whole body to function as a whole, to really benefit each other. So that's what I would continue to push, is to kind of focus on getting that whole body assessment to be looked at and kind of getting it a little bit more functional.
Couldn't agree more with that one. And again, similar story. Had to kind of figure that one out on my own, and feel like I've wasted a lot of
Yeah.
time figuring it out sooner. Last question is, what does being an athletic trainer mean to you?
Kind of goes back to that, having an opportunity to impact somebody's life and be, a positive influence in their life. I feel like I'm pretty blessed to be able to have students all across the country come out and shadow me, at the University of Colorado Hospital in our orthopedic trauma department. They come out here and hang out with me, and I just hope that I can influence them as much as the people that influence me, whether it's my parents, my brothers, um, friendships, coworkers, things like that. Like, I just want to make sure that I'm leaving a lasting impression, from the people I come into contact with, to the patients I deal with. Like, that's kind of one of those things. I want to impact somebody's life, and hopefully they'll return the favor, and we just kind of see that trend going. And it's kind of one of those 26 ways of giving back. Like, if you're at a fast food place and you pay for your meal and pay for the person behind you, I bet you as you slowly pull away, they're going to pay for somebody else's meal, and hopefully that trend just keeps going and going and going. And how good that actually how good that actually makes you feel, that you started a little something like that, and maybe it's going to continue for a little bit. At some point it's going to stop, but then, hey, let's do it again. And so that's me. I'm bringing students in to hopefully impact them in a positive way, and they'll take that back with them and do it to somebody else.
Love it. Perfect. Um, Kind of just to wrap up, if people wanted to connect with you, what would be the best way, or follow you on social media? And we'll link all this up on the episode page, but just so you can shout it out now.
Yeah, so it's Thunder Dan and the letters ATC, at Twitter, and then that's my email account as well, as thunderdanatc@gmail.com. Feel free to give me a shout out there, and we can definitely connect and go from there. So yeah, it's been awesome to be able to connect with you and be able to be on this, and hopefully people can listen to it and have a bunch of questions, and it just leads to further discussion.
Absolutely. I appreciate you taking the time and being patient with me to get this actually
Uh,
set up. So
Absolutely, man.
awesome. Well, thank you very much, and we look forward to chatting with you again.
That sounds great. Thanks, Joel.